Welcome. My name is Rachel, and my pronouns are she, her. I am a designer at AmFam Group, and I am autistic. Today I'll be sharing about Autism Spectrum Disorder, adults with ASD in the workplace. In this session, I'll be answering the following questions. What is ASD? How may ASD present differently between men and women? What are some examples of ASD symptoms in the workplace? And lastly, what accommodations or treatments are available? I hope you take with you a new understanding of ASD, the strengths and difficulties those with ASD face, and how you can be an advocate for your fellow neurodivergent coworkers. First, what is ASD? Autism Spectrum Disorder, ASD, occurs in all age, racial, ethnic, and socioeconomic groups according to the Centers for Disease Control. The autism spectrum is infinite and multidimensional. Just like neurotypical people, folks with ASD have strengths and needs across multiple facets. Labels such as high functioning and low functioning are no longer used to describe people with ASD. Instead, terms such as low, medium, and high support needs can be used to describe the level of supports required. Asperger's, formerly known as high-functioning autism, was removed from the DSM, the Diagnostic and Statistical Manual of Mental Disorders. Instead, the DSM now uses the umbrella term Autism Spectrum Disorder, or ASD, to define a range of neurodiverse characteristics. Let's discuss people-first language and identity-first language. People-first language may sound like, I am our team's designer Rachel, and I am a woman with autism. Or simply put, I am a person with autism. Someone using identity-first language may say, I am the autistic designer on our team, Rachel. Or simply stated, I am an autistic person. Autistic people can choose how to identify and what language to use. I use both a people-first and a identity-first language to describe myself. P.S. The words autism and autistic are not proper nouns and do not need to be capitalized unless at the beginning of a sentence. ASD is diagnosed 4.5 times more in men than in women, meaning that 1 in every 45 men have an ASD diagnosis while only 1 in every 200 women are diagnosed. Women and girls are believed to be severely underdiagnosed with ASD compared to their male counterparts. How does ASD differ between men and women? Autistic women, especially those diagnosed later in life, are often able to mask. What is masking? Masking is the ability to mimic social standards or personas. Autistic women and girls often have a larger range of emotions than men and boys. This often makes autistic women more successful than men and boys at adapting to social standards, but often with increased exhaustion, anxiety, and stress. The older an autistic woman gets without a formal diagnosis, the more likely clinicians are to be skeptical when she seeks an autism evaluation. These women often hear invalidating comments like, but you seem so normal, or, but you don't look autistic. This skepticism, along with outdated and sexist practices, compile to make it difficult for adult women to receive an ASD diagnosis or accommodations. This contributes to the underdiagnosis of women compared to their male counterparts. Despite these barriers, there are ways we can be more accommodating and inclusive. What are examples of ASD symptoms in the workplace? ASD is generally defined by difficulties in social interactions, verbal and nonverbal communication barriers, and by repetitive or ritualistic behaviors. Social interactions in the workplace that are impacted by ASD may present as talking to your coworkers the same way you talk with your family and friends, sometimes resulting in oversharing. Or when you're having a conversation with your boss, you prefer to look at the wall, her shoes, or anywhere but directly into her eyes. You avoid eye contact or fail to maintain eye contact. Examples of verbal and nonverbal communications impacted by ASD in the workplace include: your coworkers may say that you speak like a robot or lack inflection in your voice. When talking with your boss, you have difficulty telling if they are happy with your performance or mad at you. Or you find it difficult to follow along in verbal conversations and find it helpful to use live captions. You may also prefer written meeting notes. The last areas commonly impacted by ASD in the workplace are repetitive or routine behaviors. For example, each item on your desk has a special place, and you don't like when the cleaning company rearranges it to dust. Or, during meetings, you find yourself making involuntary noises or movements, like clicking your tongue, rocking in your chair, or even flapping your hands. What accommodations or treatments are available? First of all, there is no known cure or universally prescribed medication to treat ASD. However, medications are available to address comorbid conditions and symptoms associated with ASD, such as anxiety or ADHD. Additionally, ASD is a lifelong disorder with varying degrees of impact and support needs. One of those supports is cognitive behavioral therapy, CBT, or talk-based therapy. Having a trusted professional to confide in can provide support to those with ASD. Offering sensory-friendly workspaces allows all employees to be effective. Examples of sensory-friendly workspaces are allowing the use of noise-reducing or blocking headphones, allowing off-camera virtual meetings, and offering quiet, light-adjustable workstations. A designated workstation can reduce anxiety and ASD-related transition symptoms. Establishing clearly defined social rules can also help to provide a more inclusive and accommodating workplace. One example could be removing eye contact as an expectation during interactions, meetings, or reviews. It can also be helpful to establish mentors to assist in breaking down larger tasks into smaller work units. For example, a mentor or teammate can provide written, bulleted lists as takeaways from in-person or verbal meetings. This allows the teammate with ASD to process the information at their own pace. It's important not to condemn or penalize ASD symptoms such as stimming, challenges interpreting facial expressions, or difficulty with the back and forth of conversations. Instead, acknowledge and promote the strengths that many people with ASD possess, such as honesty, attention to detail, the ability to hyper-focus, a strong adherence to rules, and problem solving. Not only are reasonable accommodations important for retaining phenomenal employees, it is the law. Folks with ASD are protected under the Americans with Disabilities Act, or ADA. It is illegal to discriminate on the basis of disability. Now that you've learned more about ASD, we ask you to think of one way to be a more inclusive team member, and share that action in your next huddle. Thank you for taking the time to learn more about ASD with me today.